Hello everyone, my name is Gerardo Tinajero. I'm doing my presentation on the male reproductive development, broken down in ages. So we're going to start off with the male prenatal development and hormones. The hormones for the prenatal stage on a male is going to be testosterone, and that's actually going to be throughout like the entire stages of life. But the main one that I want to point out here is the anti-Müllerian hormone. Of course, the testosterone produced by the Leydig cells and testes, testosterone is crucial for the development of male internal and external genitalia. It promotes the formation of the Wolffian ducts and interstructures such as the epididymis, the vas deferens, the seminal vesicles. The anti-Müllerian hormone, or AMH for short, is secreted by the Steroli cells, and it does cause the regression of the Müllerian ducts, which would otherwise develop into the female reproductive systems. When it doesn't, that's when you start seeing people with like hermaphroditism. Now, the changes in hormone secretions during development, during the early gestation, there are high levels of testosterone. They are produced to ensure the proper development of male genitalia, of course. And later during this gestation, though, it is going to decrease just enough to support the continued development of those male characteristics. The um, decreasing levels, again, is just to prevent any abnormalities. And again, the high levels just to uh, distinguish male from female in terms of genitalia. Now, infancy, so once from birth to 2 years old, again, testosterone is going to be active all throughout life. We'll talk about it a little bit more later. But now we're having the luteinizing hormone secreted by the anterior pituitary gland. It stimulates the testes to produce testosterone. It supports the development of the male characteristics still, and they do peak first for the first 3 to 6 months of life. This is pretty much to set up the stage for a future reproductive health. Afterwards, they will go down to normal to prevent an early onset of puberty. Testosterone, again, it influences the growth of the penis, testes, and it does affect brain development throughout life, but as early as infancy, and it does impact cognitive and function and behavior. But now from 3 to 5 years old, now we have, of course, your testosterone, but we have your growth hormone, and this one is kicking in on all cylinders. And this is to make sure that children help develop those growing milestones. So that's why children are growing so fast, and that's because of this growth hormone right here. The influence on these systems, like the hormones, of course, the endocrine system is gonna regulate the balance and production of these hormones. Reproductive system, of course, will maintain the characteristics of male, and their testosterone will be low levels again to offset that premature puberty. In your musculoskeletal system, it'll straighten up the bones, the muscles, and of course, help it grow at this stage specifically. Well, going on really, because it does bleed into the middle to late childhood, which is 6 to 12 years old. You have your testosterone levels still at normal growth, let's call it low growth, to prevent that onset of puberty. Your growth hormone is still growing fast, and this is again for that development, your bones, your muscles, your cognitive functions. Well, that's more like the testosterone, but nonetheless, this growth hormone is gonna help you develop the rest of the body as well. So that's why they're high. Now, during male adolescence, 13 to 18 years old, that's when you really start seeing some changes from boy to I don't want to call it early adulthood, but like to having more of those physical characteristics. That's because the testosterone is starting to develop at a higher rate. and you start seeing those secondary characteristics. You're talking about puberty now, so you start hearing changes in boys' uh, voice, so it's deeper. All of a sudden, you start seeing a bigger muscle mass on them. They're growing hair in their face and other parts of the body. The luteinizing hormone and follicle stimulating hormone um, do stimulate these testes to produce that testosterone. And at this stage, we start seeing what's called a spermatogenesis, which is the production of sperm. So it'll increase males, in biology, they call it fitness, your ability to reproduce. Now, uh, these testosterone levels are going to increase a lot. They're not going to peak till like later in life. We'll talk about it right now. But again, this is for the maturation of the reproductive system. Now, early adulthood, 19 to the 20s, I guess 29 really. The testes will always be the primary reproductive structures. Now, the luteinizing hormone and follicle stimulating hormone are going to play a role here as well, just like the uh, late childhood, I guess, the teenage years. Now, the testosterone, as I was mentioning, is peaking at age 20, and it's kind of gradually, slowly begin to decline. I believe it's 1% per year after the age of 25, if I'm not mistaken. I'm pretty sure that's 100%. This is to support the full development of those secondary sexual characteristics, right? Your body mass, like your muscle mass, your bone density, your hair. And the LH and FSH are stable just to keep producing that sperm so the testes can produce the testosterone and they can produce that sperm. During the middle adulthood, 30s to 60s, kind of where I land, not kind of, that is where I am. The levels do begin to decrease and you start feeling it more, those testosterone levels. So you are starting to see uh, changes in your body. You start feeling more fatigued. You start feeling um, less strong, a little bit weaker, and that's because of the decrease in production of testosterone. It's been at a higher level to where you can feel the difference. Your bone density is lower as well. Um, Now, one thing I want to point out for the nervous system, it's that it also impacts your cognitive functions, the testosterone, which actually can lead into repercussions to the overall mental health. We'll talk about this in a second. So we're talking about late adulthood, which is 61 years old to death. Same hormones, same testes, right? Except older. They do produce testosterone, but it is not as effective and it is diminished to a point where you can call what it's termed as andropause, like women's menopause, but the such levels, low levels of testosterone, just leads the male body to just become more fatigued. You start feeling more irritable, more anxious. Your sex drive is practically gone out the window. That's why you see those pill commercials. Demographic is usually like people of advanced age. Uh, your muscle is basically atrophying at this point. Your memory is, you find it hard to focus and to remember stuff, fortunately. And these low levels in testosterone do have an impact on also in your cardiovascular system. So you do have higher risk of heart disease. And these lower testosterone levels, again, since they are the ones that produce the sperm, you're gonna have a lower sperm count. This is a natural process of the body, of life, right? But unfortunate. So things we can do to litigate these things to the best that we can is just a healthy lifestyle, habits, as well as a good diet. Maybe if yeah, everybody's different, maybe you can go into some sort of hormone therapy, like taking testosterone, depending if your doctor prescribes it and if you're low at an earlier stage. But it's the natural body of the process, unfortunately. I want to say, right, but it is what it is. Thank you guys for seeing my presentation. If you guys have any comments or questions, feel free to leave any down below.